This presentation is a review of environmental cleaning for the school and childcare settings. There are two objectives for this presentation. One, to identify what surfaces should be cleaned and disinfected to prevent the transmission of COVID-19, and two, to review considerations when cleaning and disinfecting surfaces in school and childcare settings. Can COVID-19 be transmitted by fomites, in other words, surfaces, objects, or food? COVID-19 is transmitted primarily via droplets and aerosols during close, unprotected contact. Although it may be possible that people can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes, fomite transmission, this is not thought to be the main way the virus spreads. However, fomites can contribute to the transmission of other respiratory and gastrointestinal pathogens, e.g. RSV, norovirus. Therefore, environmental cleaning remains an important infection prevention and control measure in schools. This slide reviews a few points to remember with respect to environmental cleaning. It's important to note that environmental cleaning is one measure in a bundle of measures used to prevent the transmission of COVID-19. No single measure should be relied on by itself. Cleaning and disinfection are two separate processes. Cleaning must be done before disinfection in order for disinfection to be effective. When we speak about cleaning, this refers to the physical removal of foreign material, for example, dust or soil, and organic material, for example, blood, secretions, excretions, microorganisms. Cleaning physically removes rather than kills microorganisms. It is accomplished with water, detergents, and mechanical action, for example, scrubbing. The process of disinfection refers to the inactivation of disease-producing microorganisms. This is product specific, and you should always follow instructions on the manufacturer labels. Cleaning and disinfection of environmental surfaces is a key step in infection prevention and control. High-touch surfaces are those that are more likely to be touched or handled, including light switches, doorknobs, desks, handrails, and faucets. Surfaces that are frequently touched are more likely to become contaminated and are to be cleaned and disinfected on a regular cleaning schedule and more frequently if the surface appears visibly soiled or is a surface that is more frequently touched. Use cleaning and disinfectant products according to the manufacturer's instructions for use, MIFU, following direction for dilution and contact time. For effective disinfection to occur, the product must be in contact with the surface for a specific amount of time, contact time, before being wiped away. For most disinfectants, the surface should remain wet for the required contact time. Ensure you apply sufficient product and allow product to dry on the surface. Don't wipe it dry. The MIFU for a particular cleaning or disinfecting product, including wearing any recommended PPE, should always be followed in order to protect staff from potential exposure to infection during cleaning or from potential exposure to the cleaning and disinfecting product. Consider a sign-off paper, virtual or otherwise, documenting when the last time the washroom or other communal rooms are used. This can be helpful for quality control. This slide provides an overview of the surfaces that should be cleaned and disinfected. All common areas should be cleaned and disinfected regularly, e.g. minimum daily. Clean and disinfect items or surfaces touched by a person who develops signs or symptoms of COVID-19 as soon as possible. As risk of infection related to sharing equipment, e.g. toys, gym equipment, is low, emphasize regular hand hygiene to reduce the risk of infection related to shared equipment. What do you do with items that can't be cleaned easily? Direct contact with respiratory droplets of an infected person is the primary means of COVID-19 transmission. Transmission of the virus that causes COVID-19 via fomites, while theoretically possible, is unlikely. Studies show that levels of the SARS-CoV-2 virus that causes COVID-19 infection decline on surfaces over time naturally. Choose items and toys that can be cleaned and disinfected easily. If using items that are not easily cleaned and disinfected, incorporate regular hand hygiene into activities. This also applies to paper products, where hand hygiene before and after shared use can be recommended instead of quarantining paper products, e.g. books, schoolwork. Paper products are unlikely to be a significant source of transmission, and quarantining can impact access to learning resources. Furniture made from soft, porous material or fabric should be cleaned or vacuumed on a regular basis, e.g. weekly, and steam cleaned when stained or visibly soiled. If you would like more information, please see the list of resources here. PHO would appreciate your thoughts on these refresher presentations. Please visit PHO's School Resources webpage to access and complete a short survey. If you have questions, please email communications@oahpp.ca. Thank you.